Yeah, unfortunately, I have had some negative experiences in healthcare when I'd had a number of miscarriages. My husband and I went in to see a female OBGYN to get an assessment and find out would we ever be able to bring a child to term. And without even looking at me, she looks down, she says, so I see from your medical records that you're an habitual aborter. You could have knocked me over with a feather. All I wanted was to have a baby. And this woman had just, as far as I was concerned, as far as what it felt like, she called me a name. Whether it's the correct medical term or not, there's a lot of political loading and weight to the word abortion. And to call somebody an aborter, especially under those circumstances, was unthinkingly cruel. Similarly, when we did have a pregnancy, I was about 13 weeks along and I started hemorrhaging. And we went into the emergency room and they said, okay, yeah, we've got to wait, so you go sit over here. By the time they eventually got to me, I was wearing sweatpants, and this is a little graphic because they were soaked with blood. And so when they realized that, things started moving more quickly. They said, all right, we're going to keep you overnight. And as the nurse is tucking me into the hospital bed, she pats me on the shoulder and she says, it's okay, sweetheart. You'll take better care of yourself next time. That transferred all of the fault for what was happening to me. And it became something I had done to cause the bleeding and potentially to cause the loss of this much wanted baby. And in the end, it turned out I didn't do anything wrong. It was just something that happened. That moment was, again, completely unnecessary and thoughtless on somebody's part. And I don't think that the woman thought through how I was going to feel when she said those words to me. In those circumstances, you're pretty vulnerable when you're seeing a doctor. And to have them say something hurtful, it makes you wonder why you bother going to see a doctor at all if you're going to come away feeling worse than you did when you went in. So for the rest of my life, I was a little hesitant about sharing information with doctors, about telling them how I truly felt. The doctors that I work with tend to be the kind that listen and, that offer comfort, that offer empathy. I immediately think about my dermatologist. She meets with you until you're done talking. You're not just another appointment. I'm Beth. I walk in there and she knows my name and she remembers me and she spends time with me, and I feel appreciated as a person. Taking the time to really listen to people and to think about where they're coming from. The most important is that you treat me like a human being with feelings. I am not a clinical being. I'm a human, and I want you to treat me that way, just like you would your sister or your cousin or someone you care about.